So this week we're going to focus on reducing low back pain through using specific exercises or stretches. So my friend Leslie today is going to help demonstrate some of these positions for you. So the first one is a Piriformis Stretch. So you're going to put one foot on a table or a surface, a chair, that is a little bit higher than your knee, and you're going to try to put the opposite knee of the one you're standing on to that chair, surface, or table, and then have the other foot flat down. Then, if you don't feel a stretch, go ahead and lean forward from your hips and try to get a deeper stretch, and you should feel it in your butt, back in your glutes. And that's at your piriformis. You want to hold this stretch for about 20 to 30 seconds and do it on both sides and perform the stretch at least 2 to 3 times a day. Go ahead and get on the table, Leslie, for me, and go into a lunge. So this next stretch is going to help with your quads and your quadratus lumborum, or your QL, which is one of your side flexors for your spine. And so you're going to get into this lunge position, and in this lunging position you're going to make sure that your knee is over top of your front foot and that you have 90 degrees going with each angle at your legs. And with this stretch, she's going to reach across her body to the opposite side overhead and then grab with the opposite arm to get a good stretch on that QL. At the same time, lunging forward at the front knee to get a stretch at the hips. And keeping your body straight up in the air at the same time, getting a good stretch at the hip and quad while also stretching the QL. You want to hold this stretch for at least 20 to 30 seconds and do it at least 2 to 3 times on each side, and you can do it 2 to 3 times a day with those sets. Now we're going to go into a quadruped position, hands and knees. We're going to create a square box with making sure that the shoulders are straight above the hands and the hips are straight above the knees. So we're going to create a square with the body. And the first exercise we're going to do in the quadruped position is a thoracic fold. So we're going to put one hand on the back of our head and then rotate so that way the elbow is then extended back to the other side of the body, keeping the hips stabilized and returning back to center. Each time you do this exercise, you're going to keep going farther through that stretch as you can. You should feel it open up one side of your back and go through to a third time and hold for about 5 seconds. And then relax back into position, and you'll do it again on the other side. Switching hands, grabbing to the opposite head, and pulling. You want to do that exercise at least 2 to 3 times a day and making sure you're holding that stretch for the thoracic fold at the 5-second mark on the 3rd repetition. The next exercise is a cat-cow position. So we're going to get into positions similar to that of a cat and a cow, a cat when it's scared and a cow when it's lying down. You're going to start in a neutral spine position. We're going to keep the spine relatively straight, similar to when you had it when you're doing the TA contraction. So first we're going to go into the cat position. So Leslie's going to raise her spine up, keeping her hips and shoulders stabilized. So we aren't pushing off with the arms and we aren't pushing up with the back. It's all through this thoracic spine, raising up the top and then returning back to center after holding for about 5 to 6 seconds, and then dipping down at the mid-back as low as you can. Notice that she's not bending her elbows and her hips aren't splaying out. She's keeping everything straight in line, and then returning back to center in the back. This is going to open up the joint spaces and allow the discs some breathing room, and also allowing the muscles to relax in position. So you'll go through each cat-cow position. Go ahead and go through the cat again, Leslie. You're going to hold each cat-cow position. 1 repetition through each cat and cow would be considered 1 rep. You want to do at least 10 repetitions and 2 sets of these. So 20 total with a rest in between. You can do this about 2 to 3 times a day if you want. Then you're going to lay down on your back to continue through the exercise. We're going to go through an exercise called a hip swivel. So we're going to bend our knees up to about 45 degrees. And keeping our knees and feet together, we're going to swivel our hips while keeping our back relatively flat on the ground. to each side, making sure that each of these motions is pain-free. So go as far as you can with a pain-free range and then return back to center. Making sure that you're moving from your hips and back to the other side, and making sure pain-free range and coming back to center. You want to make sure that you do this exercise as slowly as you can within a controlled range, and if you want, you can also hold the TA contraction that we learned last week. So go ahead and rotate your hips again, Leslie. So we're moving from this lumbopelvic complex and basically bring your knees down to the side and back up to center. This exercise is opening up your lower back and your sacroiliac joint, which can sometimes get inflamed from carrying large pieces of equipment with improper core stability. Then we can also do this exercise with the knees farther apart to get a better internal rotation stretch for our glutes. So now we're going to have our knees start now going through that hip swivel. So go ahead, Leslie, you're going to bring your foot down or knee down, good, and then you're going to try to bring the knee that's closest to the body here on the side, close to the table, so we're going to get a stretch on that glute, and then come back up to center, and then go in the opposite direction, and same thing, the leg that is on the opposite side of the direction you're going, you're going to try to push that one down to the surface that you're laying on a little bit farther to get a stretch on that glute, and then back up to the center again. The last exercise that we're going to do is a lumbar stretch. So you're going to bring one knee up and across your body, and you can place an extra pressure on that with the opposite hand on your knee and push. So you're going to get a good stretch on the side from your hip all the way up your back, and if you want additional stretch, you can have someone else stretch you. You can do this as a partnered effort. Put pressure on their shoulder as they pull their leg down. So you keep the body down heavier and you get a better stretch along the outside of the back. So you can do this on both sides and do it 2 to 3 times, holding for at least 20 to 30 seconds per stretch. Same thing on this side. She's going to push down, get a good stretch from the glute all the way up the back, and then I can also put my hand on her shoulder to help stabilize and create an even deeper stretch. So hopefully this gives you guys a good idea of some different exercises and stretches that you can do in order to assist with your spinal mobility.